Good evening and a very warm welcome to Rwanda Television News with me, Gloria Mutesi. We begin tonight's edition by informing you that this afternoon at Urugwiro Village, President Paul Kagame received Mr. Hang Shia, the UN Special Envoy for the Great Lakes region. The Minister of Foreign Affairs and Cooperation of Rwanda, Dr. Vincent Biruta, paid a one-day visit to Tanzania as a special envoy and delivered a message from President Paul Kagame to Tanzanian President Samia Suluhu Hassan. As Ethan Tashube reports, Dr. Vincent Biruta was accompanied by the Tanzanian Foreign Minister and the Ambassador of Rwanda to Tanzania.
Dr. Vincent Biruta, the Minister of Foreign Affairs and Cooperation of Rwanda, arrived in Tanzania on Thursday, where he delivered a special message from President Paul Kagame to his Tanzanian counterpart Samia Suluhu Hassan, the President of the United Republic of Tanzania. The meeting was held at Chamwino, the Presidential Palace of Tanzania, in the capital Dodoma. A statement from the Tanzanian presidency said that the Tanzanian President, Samia Suluhu Hassan, thanked President Paul Kagame for the special message he had sent to the Tanzanian head of state and assured him that Tanzania was ready to further enhance bilateral cooperation between the two neighboring East African countries.
His Excellency President Samia Suluhu Hassan thanked His Excellency Paul Kagame, President of the Republic of Rwanda, for sending him the message of condolences on the death of the late President Dr. John Pombe Joseph Magufuli, and thanked her for agreeing to take on the duties of the President in Tanzania. President Samia also assured President Kagame that she would continue to further strengthen relations between the two countries.
After delivering the message to the President of Tanzania, Dr. Vincent Biruta said that in addition to his message to President Suluhu, they also had a good opportunity to discuss the issues of cooperation between the two countries.
I came here as a special envoy of His Excellency President Kagame to Excellency the President of the United Republic of Tanzania. It's a message which I handed over to her. But we used the opportunity also to discuss about a bilateral relationship between the United Republic of Tanzania and Rwanda, and to discuss a certain number of regional issues as well. We are working together on a few number of sectors, a certain number of projects. Like energy, we have a common project at the Rusumo border, an energy project. We are working on a standard gauge railway project, and we know that Rwanda is using the port of Dar es Salaam as the main port for transport of goods through and from Rwanda. So there are very many sectors we are working on together.
Dr. Vincent Biruta, the Minister of Foreign Affairs and Cooperation of Rwanda, was accompanied by the Tanzanian Foreign Affairs Minister, Liberator Muramura, and the Ambassador of Rwanda to Tanzania, Major General Charles Karamba. Reporting for RwandaTV News, Ethan Tashube.
Let's now go to Russia, where Rwanda's Prime Minister Dr. Edward Ngirente has noted that it's necessary to find sustainable investment in tackling the effects of the COVID-19 pandemic. He said this during the opening ceremony of the 24th St. Petersburg International Economic Forum. Innocent Mugabo has more.
Indeed, only through the action.
During the opening ceremony of the 24th St. Petersburg International Economic Forum on lessons learned from the COVID-19 pandemic, Rwanda's Prime Minister Dr. Edward Ngirente highlighted the lessons the COVID-19 pandemic has left to the world, where he says that no one can guarantee safety as the numbers of those safe remain less.
And what you have learned also is that being selfish is not a solution, because you can be selfish in terms of sharing. Financing by the virus is everywhere, and it moves to everyone.
The Prime Minister says that sustainable investment is needed to address the impact of the COVID-19 pandemic.
We need to make sure that all investment we're doing have to be a strategic investment. We have seen now with COVID that some investments which were not really focused on, like investment in water and sanitation, could be the good answer to fight against COVID, for example. So we need to be strategic in different investments we are doing, and to be also strategic in a way we partner with, partnership between developing countries and developed countries.
At the forum, Prime Minister Dr. Edward Njirene said that this is the time to invest in Africa and Rwanda in particular to build the necessary and sustainable investment in the fight against the COVID-19 pandemic with an emphasis on adequate infrastructure, education, health, improving the well-being of the population and the manufacturing of vaccines and medicines. Innocent Mugabo, RTV News.
Many thanks, Innocent Mugabo, for that report. Now, social workers believe that civil marriage facilitates good relations and good well-being of family members within a family. It's while statistics on marriages from the civil registration, which were computed, show a decline in the number of marriages registered. In Kachiri sector, Gasabo district, the executive secretary of this sector is presiding over the civil marriage ceremony. Witnesses to this ceremony say that this is of great value. When you get married before the law, you don't just wake up and decide to divorce your spouse. This is a very significant step. It should be greatly valued. The fact that you went to the sector to take the commitments that will help you build your own home. It's not ideal that people should stay together without being legally married. When you come to the sector, you've given value to the family and to yourself as well. Before the law, you become husband and wife. However, statistics on marriages from civil registration, which were computed in 2020, show that a total of 30,859 civil marriages were registered in 2020, down from 48,526 in 2019. The Director of Social and Demographic Statistics Unit at the National Institute of Statistics of Rwanda says that some of the reasons for the decrease include the COVID-19 pandemic and some sectors not fulfilling the requirements. He, however, says people should see the value of living together when they are legally married before the law. When someone gets married legally, there is order in their home. The people that have chosen to be married know what is expected of them and how they'll manage their property. And this goes hand in hand with the order and peace in a home, ultimately to a peaceful country and even beyond. When people get married young, below the age of 21, it means that they didn't finish school, and so they will perhaps have many children. And that's where we see cases of maternal mortality because of girls that give birth when they are still young. Sector executive secretaries who are responsible for overseeing the civil marriage ceremonies say that people that live together without being legally married often have conflicts in their homes. These people usually have conflicts in their homes, and in extreme cases, people lose their lives from them. We have families in our sector that are going through domestic violence, which has an effect on the children they give birth to. Sometimes these children are robbed of the right to be raised by their parents, and they lack basic needs in life. Statistics from civil registration show that Gasabo district had the highest number of legally married couples in 2020 with 2,746 couples, while Chirehe district had the least number of legally married couples at 465. 98.1% of legally married couples often prefer to go for community of property regime in their matrimonial regime. In other news, the Nyarugenge District Administration says that the construction of a maternity ward at Muhima Hospital has now been completed. This gives hope that the medical facility will offer improved medical services to expecting mothers. Jane Mutuni continues with the report.
The Muhima Hospital in Nyarugenge District, Kigali City, is well known to offer maternity care and pediatric consultation. Some of the women at the hospital who just gave birth say they are well taken care of, although there is a shortage of doctors, along with the issue of a small waiting room, which they say it is uncomfortable. Their services are fair, but there is need for more doctors because we are very many. We were very many as we arrived in ambulances, and by the looks of it, the doctors were few, hence they were overwhelmed. One of the hospital's midwives says that although they try to provide better services, the number of mothers at the hospital is very high compared to the capacity of the hospital. This issue leads to situations where a mother in labor may have to wait longer than intended because of how many they are. Our first request or wish is to have a bigger space for them because sometimes they have to share a bed. If only we had enough space for mothers who just gave birth, it would be helpful, as well as increased number of midwives equivalent to the task at hand. The general manager of Muhima Hospital, Dr. Pascal Nkubito, says they are still happy with the level of service they provide, despite limited infrastructure. Last May, the hospital received 679 mothers, whereby every 24 hours, 35 mothers give birth.
Services
are well provided, but we still face different challenges. The first one is the number of mothers we receive, which is beyond our capacity, especially in terms of accommodation, because the waiting room is still small, and there are also so many compared to the number of doctors we have. The first goal is to expand the waiting room because it's small, and the other is to increase the number of doctors so that we can be able to provide enough care to each mother.
bakaba kwiyongera kugira ngo mu byukuri twumve ko dufashije umubyeyi uko abyifuza.
The Nyarugenge District Executive Administrator Ngabonziza Emi says that in the next fiscal year, there is a plan to expand and renovate Muhima Hospital.
Muhima Hospital has been facing a big challenge of receiving a big number of patients. And it has been very difficult for those who have been looking for for medical services. But as of now, the district has got another hospital of Nyarugenge, and we have so far constructed a maternity health post in Karama, in Kigali sector. We are expecting to resolve this issue by releasing the district hospital of Nyarugenge to serve more, to give medical services to the population. Two, we are expecting to renovate Muhima Hospital and expand it in the next fiscal year to the extent that will increase its capacity by at least 50%. Specifically serving or giving services related to maternity services.
Nyarugenge Hospital has already been completed but is currently being used as a COVID-19 treatment center. It is expected that the hospital will be able to accommodate at least 120 expectant mothers per day in the post-COVID times. Another maternity facility is being built in Karama, Nyarugenge District, which will be ready in July and will offer improved services to expecting mothers, reducing pressure on the crowded Muhima Hospital. Karama Health Facility is valued at 125 million Rwandan francs, and the equipment to be used in this facility is worth 30 million Rwandan francs. Jane Mutoni, RTV News.
The French government is currently collaborating with the government of Rwanda in the health sector, especially during the ongoing COVID-19 pandemic. In this regard, the French embassy in Rwanda has been training French-speaking journalists to improve their understanding on COVID-19 to solve the issue of misinformation. Gabi Muvonyi continues.
The COVID-19 pandemic has taken a significant toll on people across the world. Experts are working tirelessly to fight this pandemic and provide the population with adequate information. The media has had a task on working against the spread of misinformation and disinformation circulating among the public.
The first reaction we had was fear. This is because we knew little to nothing about COVID-19. Whenever journalists go out on the field and are not well informed on the pandemic, it's easy to get anxious. There was a time we felt like our lives were at risk during lockdown. While everyone was indoors, we were sent out to get information and ensure that people are following the COVID-19 guidelines.
When COVID-19 was first detected in Rwanda, People had a lot of information, including fake news. There were some journalists misinforming the public, including some had problems with the administration. Another problem was there were some that went out with protective gears, which made it difficult for them to gather information on the field. Various media outlets in Rwanda are pleased with the conduct of journalists and their role in disseminating factual information to the public on the COVID-19 pandemic. The head of Department for Media Sector Coordination Monitoring at Rwanda Government's Board says that journalists still have a big task ahead because the pandemic is still ongoing.
A journalist should always be someone who looks after others, someone that knows information before and delivers it to others. So they need to put in more efforts to understand how we can cope with the ongoing pandemic. Journalists need to be at the forefront of acquiring factual information, then report it to the public.
The Minister of Health, Dr. Daniel Ngamije, points out that journalists should not be discouraged during the ongoing pandemic.
They should work professionally because I believe this is something they learn in journalism schools. So they should produce well-articulated, researched stories and that will inform the public without misleading them.
Health authorities say one of the things that set back journalists' efforts is insufficient knowledge. In an event organized by the French Embassy in Rwanda, French-speaking journalists have been trained on how to provide the best information to ensure that the public understands all it can about the virus. Juliette Bigot, the cooperation attaché at the French Embassy in Rwanda, says this is aimed at strengthening cooperation with Rwanda.
Le premier, c'est sur le plan des ressources humaines.
The first thing we need to do is to increase the knowledge of the staff in this field, including those who have already gone for training in France and for those who have come back. We also want to improve the cooperation of health institutions here in Rwanda and in France. Regarding research, an agreement has already been signed when the Minister of Health came to France and met with the director of the Institut Pasteur. This partnership will further develop the research. I would also like to say that France is now committed to expanding King Faisal, so it can accommodate a higher capacity not only at the Rwandan level but also as an international hospital in the region.
Cet hôpital afin d'en faire un hôpital de pointe qui puisse attirer des patients non seulement du Rwanda mais aussi de la région.
The French Embassy in Rwanda says adequate information on this pandemic given to journalists is a powerful weapon to continue the fight against the pandemic. Gabi Movunyi for RTV.